Neurofibromatosis. This presentation is spoken to by Lisette Islas and so table of contents. So we'll be going over the incident and patient info, diagnosis, what systems does the said disease affect, how does the said disease affect the system, and the prognosis. So, what is NF? So, NF is a genetic disease that's caused by mutations. They could be both. It could also be inherited and just random genetic mutations. So, yeah, the probability of a child getting said mutation can be vary based on what type of NF. So, the NF increases the risk of tumors and could be anywhere around the body, and there are three different types of NF. So the symptoms are dizziness, hearing loss, ringing in ears, facial problems with facial problems, in, issues with balance, and difficulty walking. So what Todd experienced with Todd's symptoms were dizziness, hearing loss, ringing in ears, and issues with balance. And there are different types of effects of neurofibromatosis, and we'll explain for the three different types. So for type 1 fibromatosis, it mainly affects the integumentary system, the nervous system, and the circulatory system. And depending if it becomes cancerous, it can affect multiple other different systems. So the neurofibromatosis can also cause scoliosis, osteoporosis, and for the tumor to have rapid formation. Um, so the neurofibromatosis can cause bumps in the integumentary system. So it could usually vary. It's some of the cases is not as severe. In other cases it is. For as seen here, it is it can vary from pretty bad to not so bad, and tumors can also form in nerves. So, and that would be very problematic for the body to be able to actually function. These would be some examples on neurofibromatosis. Neurofibromatosis is also the common type of neuro. Yeah, NF1 is the most common type of NF. It is to 30 to 50 cases are just due to spontaneous genetic mutation, and each child of any affected parent has a 50% chance of inheriting this the genetic mutation. So it's not always known if a child would always get it. Um, and symptoms can change throughout the lifespan, as seen here. Um, Children with NF are shorter than average and have larger heads, and in some different cases, cardiovascular complications can arise, such as heart defects, high blood pressure, and constricted, blocked, or damaged blood vessels. What also could arise would be poor visual spatial skills and poor academic performances, as well as a child having ADHD and not so great social skills. Um, those with NF1, they're more common to have headaches, pain, and seizure, and said tumors can become cancerous. As said before, and this increased risk of cancer can cause breast cancer in young women before the age of 50. So can cause for young women before to have breast cancer before the age of 50, sorry. Gastrointestinal stromal tumors and neuroendocrine tumors as well. Scoliosis and spine curvature can be more common and aggressive in NF1 as well. In type 2 of neurofibromatosis, um, it mainly can affect the nervous and integumentary system. Although it's least common, it's still very not great, and 50% of affected people can inherit the gene, but as also it can be caused by a genetic mutation. And if the NF, oh sorry, Um, the this NF2 has a slower grow. Like the tumors are not doesn't grow as fast. Are they don't yeah. Uh, they affect mainly the cranial, spinal, and peripheral nerves, and can also grow on the covering of the brain and spinal cord, also known as the meninges. They can. Sorry, why doesn't it move? Okay, so um, type 2 of neurofibromatosis, they can cause hearing loss, brain tumor formation, cataracts, skin tumors, and spinal tumors. And yeah, uh, they can also cause changes in the retina as well, and have peripheral neuropathy, or in other words, different types of nerve function problems, such as numbness and weakness on both sides of the body, and can happen with or without muscle loss in both the arms or the leg, both arm, both or either arms and legs. Because they're not as common, it's not really. It could be very much overlooked when when it happens in childhood. So, especially when the child has no family history of NF2. These are some examples of NF2, especially with the cranial and spinal peripheral nerves, like around here, the cataracts in the around the eye, and bumps in the face. Yeah, still affects the integumentary system for all three types. So, schwannomatosis is the third type of NF. It mainly affects the nervous system and muscle system. Still affects the integumentary system. And it's the rarest type of NF. It can be genetically and clinically distinct than the other two types. It can have multiple different tumors on the peripheral nerves and have complete neurological dysfunction in the patients. It can also have a lot of chronic pain. Although it's not, although the different types of tumor, the amount of tumors a patient may have can vary. Some may have lots of tumors, although others may not. And another type of symptom for schwannomatosis is there can be numbness, tingling, or weaknesses in the fingers and toes, and or loss of muscle function. Oh, yeah. This is sorry. These are a few examples of schwannomatosis, more serious kind, mainly on the nerves and all that. So yeah. Ciao. excited.